Hi, I'm Julie Feld. I'm the Director of Counseling at Foundations Health and Wholeness. Today, I want to talk to you about the pandemic that's occurring in our community as well as in this country and the effects that it may be having on your mental health or other people's mental health. What we're knowing based on some data from the CDC in the last 3 months is that certainly mental health is being affected by this pandemic. Typically, about 6% of the population has depression at any given time. About 8% of people have anxiety. If some people have both, and that's about 11% of people. But during these times, what we're seeing is rates as high as 30 and 40% in given states. And I was seeing that the southern states, Texas, Florida, Arizona, California, are having rates between 30 and 40%. Wisconsin's a little lower right now. I think we're averaging around 20%, depending on the depression or anxiety, but generally speaking, that's what we're looking at. So we know that people are being affected by the pandemic. The reasons are probably vast, living conditions, illnesses, losses in their family, some big things, changes to people, loss of jobs or income. But I was reflecting on the little things that are also affecting us. And I kind of coined it mini grief or micro grief. It's sometimes, it's the little things over a period of time that build up that are really difficult. So I was thinking about times in my life that I've lost things that appear to be insignificant, like my favorite baseball cap. Someone stole a box of sweaters out of a storage unit I had one time, and for a long time after that, I would get so either mad or frustrated or sad because I really wanted that sweater, or even the baseball cap. I still miss that baseball cap. I can see it and I just think, oh, one of these days I'll find it, but it doesn't come back. Anyway, it's those kind of things that can really affect us. So in these times, it's things like remembering to wear a mask, conversations to have with people or not to have with people that aren't our typical conversations we have, missing normal family functions like postponed weddings or adaptations to graduations, missing the ceremonies that we would typically have that we're not having. And we can say, well, it's, for the good and at least we're healthy. We can say those things, but the reality is it's a glitch in our step and it's uncomfortable. It's happening daily for a lot of people, on top of all those big things that may be happening to them. So the effects on our lives are significant, and we can expect that we are not going to go through it without feeling those. So now the answer is what to do about it, right? Yeah, so I think the first thing to do is acknowledge it. It's uncomfortable. Certainly we don't want to dwell on that for the whole day, but there it is again. All right, so now what do? We grab a different baseball cap. We find a different way to celebrate. We do that, but we also understand it's okay to know that it's not the same and pretend that it's the same when it's not. I think it's also important that we establish some kind of routine. Our routines have been disrupted, and so find an alternative routine, because we do better when we have routines. I think another thing to do is to stay connected to people in whatever ways you can. So, I was writing letters to my grandchildren. It's a different way to stay connected. And remember, this is all part of our journey in life. Someday, hopefully soon we'll be able to reflect on this rather than have to be in the middle of it. But it's just part of what we're going to experience, and we're going to come out with lessons learned. Thank you for listening. This is Julie Feld, and we'll see you next time.